So let us have a high-heeled topic discussion. Okay. So there is a 45-year-old gentleman presented with epigastric pain, fatigue, and generalized edema. And you have been given pictures. Okay. So the pictures, endoscopic pictures, have been given, which is the important clue for your diagnosis. So you should identify which part is being highlighted here. So here the fundus is shown. How do you tell it is fundus? So you can see the lower esophageal sphincter, and this is fundus is usually seen in your J maneuver, right? So you can see the scope in the J maneuver, the fundus and the lower esophageal sphincter. Scope in the lower esophageal sphincter, and these are the fundal glands. But do they appear normal? No. There is hypertrophy of the rugae. So the rugae are enlarged. So this condition is classically seen in the fundus on the body, and the patient is having generalized edema. So why the patient is having generalized edema? Because of hypoproteinemia. So generalized edema is nowadays called as anasarca, right? So why there is hypoproteinemia? Because in this condition there is increased expression of TGF alpha, which is the pathological basis of this disease. So increased expression of this TGF alpha leads to excess mucus secretion or mucus production, which in turn leads to hypoproteinemia. Okay, and then the other classical finding is there is decreased fundic parietal cells. So these parietal cells, as you know, is responsible for your hydrochloric acid production. So when there is a decrease in these cells, there is decrease in the production of the acid, and that is called as achlorhydria. So hypoproteinemia or hypochlorhydria or achlorhydria is a classical feature of the disease that is known as your Menetrier's disease. So one more important thing in this disease is the antrum is spared, or antrum is not involved. So most commonly it is the fundus and the body. As you can see in both the pictures, the endoscopy is showing the fundus on the J maneuver. So the patient is having generalized edema, hypoproteinemia due to hypoproteinemia, and there is a vague epigastric pain and fatigability. So when you do a biopsy of this hypertrophic rugae, you find in the pathology there is foveolar hyperplasia and glandular hypertrophy, which is again a classical feature that you see in this Meniere's disease. Okay, so one more important thing about Meniere's disease, or why it is considered important, is it is a pre-malignant condition, so it can lead to malignancy. So one of the surgical treatment is your total gastrectomy. What are the other medical treatments that are available is your anticholinergics and your PPI or your PCAB drugs and cetuximab. So these are the other medically available drugs that can be given. Okay, so since it is a pre-malignant condition, it is one of the indication for total gastrectomy, prophylactic total gastrectomy. And the high heel concepts in Meniere's disease is you are increased expression of TGF alpha and not beta. So the main culprit for all these features is due to increased expression of TGF alpha. So thank you for watching this video. In the next video we shall discuss another high heel topic.